Motivational interviewing is a patient-centered, guided method of communicating to enhance a person's intrinsic motivation to change by exploring and resolving the person's ambivalence about change and also their resistance to change.
Just to know or to read about motivational interviewing is not sufficient. It's by doing the role plays, by having the motivational interviewing be done in the context of the workshop format, which allows you to engage with the learnings and apply them. That's when the evidence shows that they are most efficacious.
If someone were to smoke 1 pack a day for 1 year, does anyone have any idea of what the volume of smoke would look like? Again, I mentioned how we're in the traditional medical model, physicians are the expert. And what we need to do is come up with new ways of communicating with patients. The 5 A's are number 1, to ask, number 2, to advise, number 3, to assess, number 4 is to assist, and number 5 is to arrange.
What we're going to be doing is mostly focused around actual role plays. We will be videotaping these so that you can review them, and it'll be a bit of homework.
Last time we talked about you trying to become pregnant, and we also did talk a little bit about the smoking and quitting. Would it be okay if we talked a little bit more about that today?
A lot of people have a hard time with quitting and then coming back to smoking. It kind of feels like you're not really getting anywhere. Is that fair?
Would you want to quit? Scale 1 to 10. 10 is you do, very much so, and 1 is not at all. What do you think? How would you rate your desire?
Kind of on the one hand, you enjoy the pause during the day or time to reflect at the end of the day, but on the other hand, you see, well, maybe it's affecting your health a little bit, and you know how much it concerns your wife, and she's worried about your health.